Good morning, friends and colleagues. It is a privilege to introduce our 2026 honored guest, Dr. Marjorie Wang. Marjorie is one of those rare individuals whose influence is felt not only through her leadership, but through her quiet, steady way that she elevates everyone around her. I'm blessed to call her a colleague, mentor, and dear friend. I've been fortunate to have worked with and learned from Marjorie in many ways. We served together on the JNS Spine Editorial Board. We've worked on multiple spine section guidelines. I had the privilege of serving as the meeting chair during her tenure as chair of this joint section, a period many of us remember for its clarity of vision. Marjorie's career in spine surgery has been defined by impact. She completed her spine fellowship at the Medical College of Wisconsin, and she would then go on to become a tenured professor of neurosurgery, vice chair of clinical operations and quality, and director of the spine fellowship program. At MCW and across the enterprise, she has led spine service lines, advanced quality and patient safety initiatives, and helped redesign how multidisciplinary spine care is delivered. Most notably, she served as Chief Clinical Transformation Officer for the Froedtert Medical College of Wisconsin enterprise, guiding system-wide efforts in clinical integration, quality, and strategic transformation. Scientifically, Marjorie has shaped how we understand cervical degenerative disease and myelopathy, leading landmark clinical outcomes research. In this joint section, Marjorie's service has been extraordinary. Over nearly 2 decades, she has served as scientific program chair, annual meeting chair, secretary, chair-elect, chair, and past chair, among many other roles, guiding the section with integrity, transparency, and strategic purpose. Many of the programs we take for granted today bear her lasting imprint. Her leadership extends broadly across organized neurosurgery. Marjorie has served on the AANS Board of Directors and multiple roles within the Congress of Neurological Surgeons. And today, she serves in potentially the most impactful role for our profession as the Executive Director of the American Board of Neurological Surgeons. But perhaps Marjorie's impact is best appreciated in the words of her dearest friends. Erica Bisson, this year's chair of this section, said, "Marjorie has been instrumental in shaping my career, not only as a brilliant neurosurgeon, but as a generous mentor and advocate. She opened doors, actively placing me in critical meetings and inviting me into research collaborations that fundamentally advanced my professional trajectory. Marjorie understands that great medicine requires great people, a vision she now brings to neurosurgery at the highest level as executive director of the ABNS. Her former department chair, now institute director, Shekhar Kirpad, said, "Marjorie is a trusted friend. She is easily one of the smartest, most genuine, and classiest people I know. I've relied on her counsel more times than I can remember." I'll close with a reflection from Chris Wolfla, her colleague at MCW and past chair of this joint section when Marjorie served as scientific program chair. Chris said, "When Marjorie came to MCW for her fellowship in 2006, she was already an accomplished surgeon. Her passion for spinal surgery has propelled her to the top of her profession. She once asked me, how could she get more involved? Well, I think today we can all see how that turned out. Marjorie, your career reflects excellence and leadership, grounded in service and friendship. On behalf of the AANS CNS Joint Section of Spine and Peripheral Nerves, it is my great honor to present to you our 2026 honored guest. Please join me in welcoming Dr. Marjorie Wang."
Right. Thank you so much, Dan, and thank you to the spine section, Erica. It's truly an honor to be here with you today with the section community. The surgeons in this room and this section have elevated spine and peripheral nerve surgery through innovation, mentorship, and an uncompromising focus on outcomes. The high expectations placed on surgeons today aren't accidental. They're the deliberate result of that leadership. We know that high expectations are the baseline, and they're very real. We feel the weight of those expectations most clearly in the eyes of our patients. When a patient hears the word spine surgeon or neurosurgeon, orthopedic surgeon, they assume a standard: technological sophistication, sound judgment in moments of uncertainty, safety, and durable good outcomes. Patients trust that every decision reflects experience and thoughtful integration of data, evidence, technology, and judgment all working together. Which leads to a fundamental question. Can we deliberately engineer the development of expertise earlier and more effectively using what practice has already shown us? Learning forward, then, is not simply about honing skill among high-volume spine surgeons. It's about intentionally using structured reflection to surface learning gaps earlier and to close them more efficiently so that excellence emerges earlier and more predictably. Surgery is only getting more complex. Options. We have more surgical approaches, more implants, more biologics, more perioperative pathways. More options mean more decisions and more trade-offs. Our patients are also getting more complex. They're older, they have more comorbidities, they expect more, better function, faster recovery, clearer answers. And they also come armed with information from sources that aren't grounded in the clinical data that we use, and that changes the conversation. And transparency, what we do is more visible than ever. Outcomes are compared across hospitals and systems, complications are tracked, and data are aggregated and published. But what's expanded even more is the amount of data that we must integrate in real time. And some of it is quantitative, imaging, interruptive metrics, but some of it's less structured, patient goals, social context, what durable outcome really means. And some of it isn't even obvious, the mismatch between symptoms and imaging, the tone of a patient's voice, the interaction with a spouse, the home environment that you glimpse on a video visit. All of that is data. We bring it together, often intuitively, in the care that we provide. And at the center of that data ecosystem isn't an algorithm, it isn't a standardized pathway. It's you, integrating complexity into a recommendation and a plan. Modern neurosurgery requires real-time signal integration. And as our field becomes more technically and cognitively complex, we have to think differently about how we support expertise, not just in high-volume centers, but also across all practice environments. That means understanding our own strengths and limitations. It means knowing not just how to operate, but when not to operate, and how to recognize the subtle red flags that affect outcome. And equally important is how we, as a section, can improve resident training and keep every surgeon up to date, reinforcing not just competency, but excellence. Spine surgery is foundational to neurosurgery, and the standards set by the section affect the entire field. Early ABNS practice data demonstrates asymmetry in case distribution. Some neurosurgeons perform spine in 80 to 100% of their practice. Others incorporate spine within a broader practice. Almost every neurosurgeon performs spine surgery, not just those who identify primarily as a spine surgeon. The same distribution of peripheral nerve is also seen across the field. And while traditionally we have used time plus volume to achieve competence, reality is more complex, and surgeons reach this milestone at different rates. Excellence continues to evolve long after we complete residency. So we have an opportunity to use our data ecosystem to accelerate structured reflection and feedback in surgery. Not just counting cases or checking boxes, but using data to inform, to create a learning system that quickly identifies gaps and delivers rapid targeted feedback. faster feedback tied to decisions, real-time ways to share knowledge more effectively. When a patient walks into clinic, they don't see all the data that we integrate. They don't see experience or analytics. They see you. They trust the standards of surgery, and they trust that you are using that full ecosystem of data to stay current. So leaning forward means that what we learn in practice should shape how we design training and lifelong learning for every spine surgeon. I believe it's our responsibility as a section to give back, to empower the field and future surgeons to learn better and faster in the pursuit of excellence. You are the catalyst to closing knowledge gaps in the field. Every one of you, whether in training, early practice, or decades into mastery, carries insight about what you wish you had learned sooner, where you have seen gaps, and where our systems lag behind real-world practice. The wisdom in your experience is the raw material for redesigning how we train, learn, and sustain excellence. So I ask you to think about these questions carefully. And here's what matters most. When you observe a gap in knowledge, judgment, or practice, identify it precisely, articulate it thoughtfully, and share it with the section. Not as abstract theory, but as a concrete way to improve how we learn, how we train, and how we practice. That is what it means to lean forward, to turn real experience into meaningful, sustained progress. And that's how we make a difference. Thank you.